Hi, I'm here with Caroline from UrgoNight. This is a device that helps you get to sleep at night, or helps you train your brain so that you won't actually need something to get to sleep every single night. Sleep is a massive problem in the United States. Something in the order of 70% of adults report that they have trouble falling asleep or staying asleep during the night at least one night a week. All right, 10% of Americans suffer from chronic insomnia. If you're getting less than 7 hours of sleep a night, you're suffering with insomnia. And insomnia results in problems with focus, concentration. It leads to higher incidence of accidents on the roads. It's a truly massive problem that can have life-threatening consequences. The end result of which is we are trying to find better solutions. We have a lot of medications on the market, but frankly, there's lots of problems with all of those medications. So the question now is, can we find a way of, in training your brain to be able to go to sleep without the use of medications? And ErgoSleep is one of those devices that is accomplishing this. So Caroline, can you tell us about this?
Yes. Good morning. I'm happy to be here with you. So UrgoNight is a unique daytime brain training solution to improve sleep. It's based on a technique called neurofeedback. So it consists of an EEG headband, electroencephalogram headband, connected to a mobile app. The headband measures your brainwaves during the day. Then the app leads you through exercises in neurofeedback, so in real-time feedback, where we want to encourage you to produce a specific type of brainwaves that is going to protect your sleep at night.
Excellent.
Yeah.
So tell me about how long you use this for every day, and how long before you start seeing results?
Yep. So UrgoNight, as I said, is a daytime brain training solution. You have to use it for 20 minutes 3 times per week. And after 15 to 20 sessions, your brain starts to learn how to produce the sleep-protecting brainwaves by itself. And after 40 sessions, you've got long-lasting results because you have re-educated your brain into better sleep patterns.
The issue here is this is not one shot fix all. You're going to have to do it repetitively several days a week, and you're going to have to do it over a couple of months in order to get the full effect. On the other hand, that gets you off all medications, that gets you a good night's sleep, and actually a better night's sleep because you're not taking any medications. In studies, what's your success rate been with the device?
Yep. So the UrgoNight device is based on neurofeedback, which has been proven to reduce the time to fall asleep by 40% and to reduce nighttime awakenings by 2. We've done our own clinical studies as well. The first one, we have the preliminary results, which are really in line with what we've seen in the past.
So a really excellent opportunity for a solution for your sleep problems with essentially no side effects. So if anything, the side effects are increased relaxation, decreased stress. So show us a little bit about how you use it.
Of course. So maybe we sit down?
Okay.
So first you have to put the headband on. Exactly. We'll just make sure it's turned on. The really important part here is that the electrodes touch your scalp. So we've got 4 electrodes that measure your brainwaves.
So the device is not the least bit uncomfortable. It's a little tight. You can feel the electrodes next to your skin, but frankly, it's not a big deal at all. And so there's really no discomfort with this.
Exactly. So then what we can start to do, the training is composed of many sessions. How do you want me to do? So these are all the sessions you're going to have to complete. That's a pathway. So once you've completed the whole program, then you're good to go.
And how long does it take to complete one of these sessions?
One session is 20 minutes. You have to do 3 sessions per week. We recommend 3 sessions per week to have the benefits on your sleep. So let's start by having a look of what's happening in your brain at the moment.
Not much. So this takes a second or two to warm up.
Yeah, it's connecting to the headband.
Okay.
And then we're going to see all the brainwaves that the headband is able to measure. The ones we want you to train with these exercises are the SMR waves. They are the ones in pink.
So tell us what the SMR waves are.
So the SMR are the low beta waves. They are the waves that you produce where you are in a concentration state. They have proven to have an impact on the quality of your sleep when you train them during the day. Then let's go back to the training. We start a session. What we start with is to give you some advices on how to produce these SMR waves, because it's not easy for everyone to understand what do I have to do to produce the SMR waves. So we give you some examples. Some people, they will focus on a point. Some other people, they'll have to clear the mind, push away unnecessary thoughts. Some people, that will be focusing on positive memories, for example. Then you have the choice between different themes of exercises. Maybe for today we'll choose the jellyfishes that you'll have to make disappear with the power of your SMR brainwaves. Now there's going to be a step to verify if the headband is well positioned on your head and if the signal is correct. Neurofeedback uses a very sensible signal, your electric signal, so it needs to be very accurate.
And that having been said, the fact of the matter is, this is pretty foolproof. It doesn't take a lot to put it on. It doesn't take a lot to set it up. So it's really simple and easy to get set up with this thing, and you don't have to worry about fussing constantly with the position of the electrodes. Once it's set, and it doesn't take much to get it set, you're ready to go.
Yeah. So for this step, it's really important to stay still and relax your shoulders. So I'm going to keep that for you so you can stay still. When the electrodes are all green, we're good to go and go to the next step. Then to adjust the difficulty of the training, it's very important for us to measure your baseline of brainwaves. So we're going to do two measures, 30 seconds eyes closed and 30 seconds eyes open. So Gary, you can keep your eyes closed for 30 seconds. Now you can open the eyes and we'll do the same thing for 30 seconds, eyes open. So here we measure in a normal state how much SMR waves you produce so that we can adjust the threshold that we're going to put for you to improve your SMR production waves. The exercise uses real-time feedback, so when Gary will produce some SMR waves, we'll see some feedback on the app that we call rewards. The rewards take the form of different things. So you've got audio and visual feedback. Here you've got the gauge filling up when Gary produces SMR waves. As he fills up the gauge, the jellyfishes disappear. His brain considers that as rewards. So I'm assuming Gary is trying different techniques at the moment. Maybe he's trying to focus on a point. That's what worked last time. If you see that the technique you're using doesn't trigger any feedback in the app, try another technique. Everyone has a different technique to produce SMR waves. So Gary just reached level 4, which means that this technique he's actually using now is quite successful. One session is made of 5 exercises of 3 minutes. So in total, if we count the calibration, a session is 20 minutes. And this is what you have to do 3 times per week. At home, what you want to do is look at your screen and try to figure out what technique is triggering the rewards. It's important for your learning process. And in addition to this visual feedback, what you can have is audio feedback as well, so that you can be in a totally immersive experience. We reached the end of the 3 minutes, and soon the results and the report will appear. Oh my God, Gary, you did 100 on 100.
Very nice.
So 100, the scale 100 is the maximum you can reach for today after we measured your baseline. So that's the maximum you could have reached for today.
Okay, so not too shabby after 2 cups of coffee this morning. The device is easy to use. Truly, I feel much more relaxed after just a couple of minutes of doing this. And over time, what it's going to do is retrain your brain so you can get a good night's sleep without needing any medications or any other devices in order to help you get that good night's sleep. That's the goal, and it will dramatically improve your health. Just to say a few things about why we need a good night's sleep. One of the things that happens in sleep, especially deep sleep, is the brain detoxifies. And so we actually need deep sleep in order to get detoxification. When we're getting interrupted sleep, when we're getting problems falling asleep, short sleep periods, we lose a high percentage of that slow wave deep sleep that we're required to get in order for our brains to detox. And so over time, you get more and more inflammation in the brain. Sleep is necessary to reduce brain inflammation. And so this is absolutely a crucial thing to be able to accomplish every single night, a good night's sleep, 7-8 hours of sleep a night. And this is a device that can help a lot of us get there. So thank you. Anything else you want to tell us about?
I think we've done everything. Like, you've seen the experience. The device is going to be available from June 2020 in the US on our website, UrgoNight.com. So please feel free to check it out and have a look and contact us if you need any more information.
That's outstanding, and we're probably going to make it available on our website as well. So, a solution for your sleep problems.